So before I dive into the complexities and challenges, I think it's really important to level set on the definition of interoperability and talk about how it impacts payers. I guess we can say the official definition here, right, is the ability of two or more systems to meaningfully exchange and ingest health data. And I think the optimal word here is meaningfully. It means that the right information is presented to the end user when they need it and in a workflow or format that ultimately works for them so they can make an impact. The purpose of interoperability is really to enable the sharing of data in a way that improves patient care, right? So interoperability really started to mature during Meaningful Use 2, where clinicians needed access to patient data from other treating providers, maybe a specialist, a hospital, or a primary care provider, in order to properly care for that patient. But if we think about the stakeholders now, it really goes beyond the provider or the health system. And even then, it went beyond that. It includes patients, health plans, pharmacies, labs, EMS, and public health, and there's many others out there. We know that providers rely on crucial information from payers to close gaps in care and improve outcomes. And on the other hand, payers need data from providers to reduce costs, improve patient outcomes, and comply with regulatory reporting standards. And this is a crucial element for any high-performing risk adjustment program because it supports suspecting analytics, medical record coding, reporting, et cetera. Historically, though, payers and providers exchanged medical information using fax machines, web portals, copy services, very antiquated approach, right? And it's not just expensive and time consuming to use these methodologies, but it also fails to give health plans the structured data that they need to drive insights. So getting this information digitally is really where the industry is headed. And we're seeing this come to fruition with things like the CMS interoperability rules, where payers have to implement certain APIs. And that's coming up quick. The deadline for that is 2027. We're also seeing it on the quality side with NCQA's requirement to do digital measures by 2030. So rapidly approaching this more digital landscape. But interoperability for payers is not easy. There's really no silver bullet solution. I really like this visual because it kind of delineates right where the complexities start. Historically, there's been plenty of support across the industry. Absolutely, really nobody was opposed to sharing data for treatment and individual access or patient access to the data. In this sort of darker color here, you can see with that use case, there's no data use agreement that's needed to be put in place when data is shared across organizations for those purposes. So that's great. And that's where we started during Meaningful Use 2. But now when we bring it down, right, and we're focused on healthcare payment and operations, which is where the payers fall in, we do need to get these data use agreements in place, especially when you're using a partner, right, or a business associate. And it can be challenging because we see providers that just say, well, I'm going to go use my copy services. I don't have the time to maybe build a connection with you. I don't have the resources to focus on this. We also hear that, I have a lot of other things on my plate. I'm in the middle of an Epic upgrade. I'm trying to focus on my COVID reporting still. I've got patches I've got to push into my EHR, and I need those resources. So that's sort of one of the big things that we've seen, right, in the industry. We also see with some partnerships too, that there's a lack of transparency in supported use cases. And what I mean by that is if you're not making a point-to-point connection with a provider or health system and you opt to go with a certain network or a data partner that's an aggregator, it can take a long time to really dig in to where they have data and where they don't, and for what purposes. There's a lot of, I think, misperception out there with some of these vendors that they have maybe access to 50 million patient lives. And that's great. But then when you ask them, how many patient lives do you have access to, or where is your market penetration for healthcare payment and operations exchange purposes? And that's where it gets really tough because there's not a lot of support out there for that. A lot of these vendors and other partners won't provide that level of transparency because they don't have a lot of data there. So it's really important to sort of dig in there. And then the data use agreements themselves, making sure that the business models really are in line with your organization and how you want to proceed, making sure that you're not getting sort of stuck with minimums as volume can ebb and flow, throughout the year. Making sure that you're outlining all the use cases for the data in those agreements as well. If, we're talking about risk adjustment today, but if you think you may want to use that same data for quality or for payment integrity down the road, making sure that that's outlined upfront in those agreements is important so you don't have to go back and try and edit them retroactively. And then lastly, there are still complexities around data and member matching. Sometimes data partners may use TIN, the tax identification number, and the provider NPI number, the ID number, together to make a match. And if they don't match up correct, if the TIN and NPI don't match up correctly, that's going to return a patient not found, and we're not going to get that chart ultimately. Sometimes we see just poor chase data coming through. Maybe it's on the payer side, maybe it gets edited at some point or something gets dropped, but really making sure that all of that information that you're sending to your data partner is as clean and as accurate as possible. I know for us at Cotiviti, we have checks and balances in place to make sure that all of that information is populated and it's not duplicative and that it's accurate to the extent possible before we send it over to our data partner. So we're not losing time, we're improving our match rates, and we're improving the chances of getting a document back digitally. And then lastly, sometimes there are things that are out of our control, right? And that could be no encounters found within the date range. And that could be attributed to, and it's just important to understand why this happens. It could be attributed to something like behavioral health notes are found within the record and it can't be shared. So anything that falls under that 42 CFR Part 2 regulation wouldn't be able to be shared. You might have a self-pay encounter where the data is not able to be shared. And that's okay, but it's just, having that awareness to know why you're not getting a document back, right? So very complex, right? This is not something that, can be done easily. We really need to have sort of this, what I call a cheesecloth approach, right? Going directly to providers and health systems to make connections and partnerships, working with other types of data partners like health information exchanges and national networks. And then also, data aggregators that maybe are, affiliated with a particular EHR system. So to add to all this, payers now have to worry about ever-evolving technical standards. In the last webinar that we did, we spoke at length about FHIR and TEFCA. And FHIR stands for Fast Healthcare Interoperability Resources. And it's really where the industry is headed, right, in terms of standardizing how data is exchanged. FHIR, in a nutshell, is a HIPAA-compliant, sort of open source way of sharing clinical data, which means that it's EHR agnostic and it's flexible. However, even though it's standard, it's sort of standard with a small s. I say that all the time. And there is added complexity when it comes to managing how FHIR is used across various use cases. So to address specific purposes and make sure that there's consistency within certain domains, they have what's called implementation guides. And these have predefined profiles and extensions. And the benefits to using these is really just to ensure that data is captured and it's exchanged the same way for the same purpose. And this ultimately improves data quality and analysis. And this is something that we are hyper focused on at Cotiviti, is making sure that we're not just pulling this data in from disparate sources, that we're mapping it correctly, and that we're using the right implementation guides when it's appropriate for specific use cases. So with that said, when you're thinking about your interoperability strategy, there are benefits to partnering with the right folks, right? So sort of in this first bucket here, right, is just your overall strategy, providing feedback, education, right? Just on the regulatory implications of things, right? The technical standards, giving advice on how to execute your program, data acquisition, right? Supporting the business cases or what's called exchange purposes, right? How can we exchange this data? What can it be used for? What permissible uses do we have covered here with our agreements, right? Aligning with the provider network, making sure that your payer network matches up to the data partners network. are understanding where you have gaps and where you may need to find additional data partners, making sure that all of the data that you're acquiring and the partnerships that you're making support meaningful data acquisition, right? And that the data is coming in a high quality manner, that you have those checks and balances in place. And then once you get that data in, making sure that you're normalizing it and mapping it so that it's deduplicated, it's clean, it's enriched. We have the right code sets and terminology behind the scenes, and that we have commonality among terms, or what's called semantic interoperability among all the terms that we're using, right? So we're comparing ibuprofen to ibuprofen, not Motrin to Advil to ibuprofen, right? When we're aggregating this data from disparate sources. And then lastly, a good partner can help you with your integration, right? Making sure that this data gets folded into the workflows in a meaningful way, making sure that it's integrated into the downstream applications and systems that you need to optimize your work and your end user experience.